Hello, and thank you for tuning in to CNN Health News Report. My name is Robin Sherbatsky, and I will be joined today by Ms. Cheryl Ellsworth. Welcome, Cheryl.
Thank you for having me.
So, Cheryl, can you tell us exactly what you do?
I'm an ICU nurse in charge with prevention of ventilator-associated pneumonia, also known as VAP.
Tell me more about VAP.
Well, patients on ventilators are in a vulnerable state. Acquiring an infection could be the difference between life and death. Also, infections acquired in the hospital can be the hardest to treat. The best solution is prevention.
Any ideas on how we can do that?
Yes, Robin, one of the most important things healthcare providers can do and teach is proper hand washing. VAP is prevented by what we call the VAP bundle, keeping patients' head of bed in about a 45-degree angle, especially when eating and feeding, along with a sedative interruption and an extubation assessment.
So it seems like the longer a patient is on the vent, the more likely they are to get an infection.
That's right, Robin. The ventilator is one of the best life-saving interventions we have. But the longer a patient is mechanically assisted, the higher the risk. Evidence-based best practice is removal of assisted devices, such as ventilators, as soon as possible.
Well, that makes sense. Any other ways to prevent VAP?
It is also important to implement peptic ulcer and DVT prophylactics.
So preventing DVTs is done with drugs like Lovenox, and Protonix prevents peptic ulcers. A close friend of mine was hospitalized and had to be intubated. I wondered why she was on all those drugs even though she had no history of DVT or peptic ulcers. So many drugs seem dangerous to give all at the same time. Isn't this risky business?
Well, Robin, you're right. Physicians must ethically determine whether the risk of medication outweighs the benefits.
Thank you, everybody.